Hello everyone. Today I will host our issues in nursing topic. And if people excuse me, I would like to share my screen with you. Where okay. We have 3 short videos and let's start with them. This is the first video about issues in nursing. If you have any trouble about sounds or let me know it. Right, and second video. And the video is about ethics in nursing, because my topic includes this one too. That's why I'd like to add some kind of video about this too.
Nurses who are in situations where they believe that what they're doing is causing more harm to their patient than good, they can feel moral distress about that. They feel really compromised in terms of their integrity, that they know what they should be doing, their ethical foundation is clear about benefiting and not hurting our patients, and yet they see the treatments that they're doing causing harm. They see the suffering of their patients, and that begins to erode their sense of integrity. What we've been trying to do is to, first of all, help nurses to develop the skills to raise these issues effectively, to move from the why are we doing this question to being able to articulate why this particular activity or this particular treatment plan is challenging the ethical values of the nurse. Underneath them are really important ethical values that need to be brought into the conversation. We have ethics consultation that's available for nurses, and I often coach nurses through thinking about what's the right path. Is this a situation where it would be beneficial to have some additional help in thinking about these issues, not just the nurse, but the whole team and the family and the patient, so that we can surface the issues and talk about them more directly.
Yes. That was our last video, and let me share my presentation with you. I'm a bit nervous, that's why I'm excited. Okay. All right. Hello, everyone. I'm Damla, and today I will present you issues in nursing. All right. Issues in nursing. As Barack Obama says, American nurses are the beating heart of our medical system. Barack Obama, the 44th President of the United States, said in 2010 address to the American Nurses Association, "We are on the front lines of the healthcare in small clinics and in large hospitals, in rural towns and big cities all across the America. As nurses dedicate their lives to caring for others, their own professional and personal needs may fall by the wayside. That's why organizations like the ANA and dozens of other membership support and advocate for more than 4 million US nurses. As part of the work, the ANA has zeroed in on some of the challenges you may face today in your nursing career. Here are their top issues for staff nurses. There are 5 issues as general. The first one is inadequate staffing, and the second one is mandatory overtime, and the third one is safety on the job, and the fourth one is workplace violence, and the last one is improving self-care. And you can see some comics here. And I'd like to add some additional detail about ethical issues in nursing, because the NLX question includes so many ethical issues. That's why I would like to inform you about them. Let's start with this part. In this section of the NSLX Iran examination, you will be expected to demonstrate your knowledge and skills of ethical practice in order to recognize ethical dilemmas and take appropriate action, inform client members of the ethical issues affecting client care, practice in a manner consistent with the Code of Ethics for Registered Nurses, evaluate outcomes of interventions to promote ethical practice. Ethics, simply defined, is a principle that describes what is expected in terms of right and correct, and wrong or incorrect in terms of behavior. For example, nurses are held to ethical principles contained within the American Nurses Association Code of Ethics. Ethics and ethical practice are integrated into all aspects of nursing care. And I add some detailed information. If you have time, please take a look at them. And let's go on with the question part. The first question, first of all, I'd like to say that I read the question and wait for 5 seconds, and you can think about your answer while I'm waiting for you, and then we can check the explanation. Okay, let's start. An emergency victim came into the ER following a massive car crash involving 2 cars and truck. The patient is bleeding incessantly from the head and shin. Just when the nurse is about to administer blood, he notices a symbol tattooed on the wrist. Which of the following should the nurse do? Ask other nurses about what the symbol could mean. Stop the advent of blood transfusion and call a doctor for further assistance. Ignore the symbol and proceed. Try to look at the symbol closely to decipher what it means and proceed. Okay, I'm waiting for your answer. Okay, then let's see the answer. The answer is B. And the tattoo could be the symbol of Jehovah's Witness, people who believe that the Bible prohibits ingesting blood. The nurse should identify cultural differences to provide holistic client care. That's why the answer is B. You can check your answer. And the second question. A young Indian girl comes in complaining of an upset stomach. Which of the following should be characteristic features during your intervention? Check her for lactose intolerance. Try to arrange for a male health care provider. Minimize family involvement. Console her by touching on the head. I'm waiting for your answer. Okay. Okay, let's see the answer. The answer is A. Check her for lactose intolerance. Let's see the explanation. Usually, Indians are lactose intolerant, and due to cultural reasons, they are more comfortable with female attendants. That's why we can't call male healthcare provider. And the next one, an emergency comes in and you have to use the principles employed in triage to deal with patients. You came across a patient who appears still and doesn't respond to movement or shouting. What should you do? Take the patient breath, shut again till you feel a response, go to the next person, open his airway to check if it is blocked, and it's to ease air flow. All right. Then the answer is D. Open his airway to check if it is blocked and to ease air flow. The explanation is TRADE is a classifying procedure that ranks clients according to their need for medical care, and opening his airway should be your first reaction. The third question is, a patient comes in complaining of abdominal pain and chants a prayer repeatedly. You try taking his history as he's fed, but he's not saying anything else. His attendant tells you that He is a staunch Mormon. Which of the following is important in deciding her dietary preferences? I hope you can follow me while I'm reading. Okay. What day of the week it is? Whether it is Ramadan, whether it is Yom Kippur, whether it is Lent period. I'll wait for your answer and then let's see the explanation. Okay, the answer is A. What day of the week it is? Why? As a part of the transcultural assessment model, it is important that the nurse identifies a culturally unique individual and identifies his dietary preferences. For Mormons, the first Sunday of the month is optional for fasting. That's why the answer is A. Fifth question. A Colombian American middle-aged man comes in complaining of occasional chest pain. Which of the following should be your ideal mode of intervention? Offer to call clergy. Ignore dramatic gestures used to express pain since they tend to be exaggerated. Be strict with time when scheduling appointments. And the last one is, in order to avoid possible alternative medicine options, do not allow the family to discuss treatment options. Okay, I will wait 5 seconds and move on. The answer is A. Offer to call clergy because of the significance of religious preferences related to illnesses. By the way, if you have anything to say or anything to discuss about, I am open for them. So next question. Mr. Samuel Batko, a Jewish man, has had a major accident and has possibly had a brain bleed, due to which he has become brain dead. Since people of the Jewish faith generally oppose prolonging life after irreversible brain damage, should you proceed with end-of-life care? Leave the person alone. Make arrangements for autopsy. Allow prayers to offer comfort. Touch the body with bare hands. So, which is your choice? The answer is A, because leave the person alone. There are no specifications with respect to touching the dead body, as in the case of Muslims and Jews prefer to have therapy around them in their last moments. That's why we don't do this. An overweight 13 years old white boy comes with his mother complaining of abdominal pain. During your interaction with the boy, you should be trying to do which of the following? The first one, encouraging family involvement. The second one, assessing the meaning of the client's nonverbal behavior. Making eye contact with the boy. Flexibility in time while scheduling care. I'm waiting for 5 seconds. All right, the answer is B, because white Americans often behave meaningful, nonverbal behavior. So that is the answer. Okay, the next question is, a Chinese nurse is asked about alternative medicine methods to treat hypertension by an African American man. Which of the following should be her response? Suggest changes in diet, direct him to a complementary and alternative medicine center, avoid giving any such information, suggest some herbal therapies that have been used in her family. All right, let's see the answer. The answer is B. Direct him to the complementary and alternative medicine center, because Since some groups are inclined toward alternative medicine, it is safe to suggest a center for it. Ninth question. I hope it is beneficial for you. While suggesting neurotherapy to patient, the nurse is likely to mention all but blah blah, which is the correct sentence to put in this blank area. It comes under the category of whole medical systems. It enhances the natural healing responses of the body. It focuses on the balance of mind and body. It contains a host of interventions, namely hydrotherapy, herbology, nutrition, and acupuncture. So what is your answer? Let's see. The answer is C, because Ayurveda focuses on the balance of body, mind, and spirit. That's why the answer is C. A person suffering from multiple sclerosis, MS, is asking you for alternative medicine methods. From your knowledge, you know that chiropractic practices have been seen to minimize the effect of MS on a patient. How will you not explain chiropractic practice to the patients? It comes under the category of manipulative and body-based practices. It involves manipulation of the spine and other joints. It relies heavily on herbal drugs. And the last one is it focuses on energy therapy. So what is your answer? It says, how will you not, by the way? Be careful. The explanation is chiropractic practice is called the science of healing without drugs. So the answer is C. You shouldn't rely heavily on herbal drugs. Okay. Whole medical system is a subcategory of complementary and alternative medicine. Which of the following statements are you not likely to use while explaining it to a patient? It includes traditional Chinese medicine, ayurveda, homeopathy, and naturopathy. It's based on the belief that your body has the power to heal itself. And it includes dietary supplements. And the last one is it involves the body, mind, body, and spirit. I'm waiting for your answer for 5 seconds. The answer is C, because dietary supplements are characteristic of biologically based chem. Right, we have 4 question behind. A patient is wearing a personal object around his neck. A CT scan has to be performed on him. Assuming that its presence will interfere with the procedure, which of the following shouldn't be part of your course of intervention? Ask permission before placing it somewhere else on the body. Remove the object while rubbing without giving any option. Ask the client about its need during the procedure. All right. The answer is B. You shouldn't do this because the object may hold spiritual significance for the patient, and hence it is essential to understand what meaning it has to the patient. We shouldn't do this. All right. Which of the following are not causes of disciplinary action against a nurse? Telling a fellow nurse what the patient told you to confidence, assuming duties without sufficient preparation, not updating client's record after minor incidents, and the last one is stopping the preparation of a surgery in case of last-minute refusal by the patient. Let's see your answer, and then you can see the answer. right? The explanation is it is illegal to continue preparing for a surgery after a last minute refusal. So the answer is D. Okay. A Jehovah's Witness comes in after a severe accident. The patient has a rare blood type and recurs blood from a close relative, but it is unwilling to contact them. What should you do? Evaluate the situation and classify it as an ethical dilemma and schedule a meeting with the ethics committee. Urge patient to contact relatives on your own, inform nursing head. What is your choice? I'm shivering, by the way, I'm so excited. The explanation is the answer is A. It's an ethical dilemma because it has occurred as a result of differences in cultural or religious beliefs, where it is best to find an ethical reason. So the last question is: a patient comes to the into the ER, and it is not responsive. A person comes along with him. Which of the following shouldn't be the descriptive of the person? The person upholds the principle of fidelity. The person represents the patient's cultural and religious views to the nurse. The person allows personal views to the influence the course of action employed on the patient. And the last one is the person is called an advocate of the patient. So what is your answer? Let's see the final answer. It is C. An advocate avoids letting personal values influence advocacy for the client and supports the client's decision, even when it conflicts with the advocate's own preferences or choices. Thanks for listening to me. I hope it could be beneficial for you. So let's move on with Kahoot part. I will give you the code so you can attend it. All right, here is my screen. Can you please join the Kahoot part? I think we are done. No, not yet. I'm waiting for other participants.
Maybe can start.
Okay.
Thank you.
A nurse is asked at the client's bedside. Another is responsible for managing client's care. Which form of nursing it is? Yes, it is primary nursing. Which isn't a symptom of fluid volume defect, skeletal muscle weakness, increased rate and depth of respiration, visual disturbance, diminished peripheral pulse. Which isn't a nurse's responsibility in maintaining confidentiality of the client, sharing the medical information with the family of the client, protecting the medical record from all unauthorized readers, discussing the client's info only in the private and secluded areas, not discussing client issues with other staff who are. Yes, I think it was a short time to do this question. In what circumstances will the minor be seen as an emancipated minor capable of making decisions through service in the armed forces, upon marriage, upon pregnancy, upon rationally convincing the doctor about their decision? Yes. What is the most appropriate action when a female client is a victim of sexual abuse and doesn't want to tell anyone? Yes, the answer is inform legal authorities after assuring her that it will stay confidential. A 16 years old terminally ill cancer patient wants to donate her organs after the death. How many she proceeds? Yes, she isn't allowed to donate her organs. Oh, you all are doing well. A nurse involved in the process of informed consent has a crucial role to play, which should not be her or him role. Yes, agreeing to be a witness on the legal documents if asked. The nurse gets call from home, leaves the patient for a while, telling not to move, but the patient falls. Is it a negligence? Yes, no, because the patient wasn't obedient. A mentally challenged patient diagnosed with the terminal cancer and wants to write a will, which won't be seen as his right. And the final question. The nurse forgets changing cylinder on time. Luckily, the patient doesn't suffer from the error. Was it his malpractice? Yes, and let's see who is the winner. Congratulations, Deniz, Fahriye, and Elif.
Thank you.